It is my pleasure to introduce our next panel, which is titled The Impact of COVID-19 on Black Children and Adolescents in Canada and the US. So our Canadian speakers will include Dr. Bukola Salami from the Cumming School of Medicine and the University of Calgary, and Khadija Brouillette from the Faculty of Medicine and Health Sciences at McGill University. Our speakers from the US include Dr. Laurie Brotman with the NYU Grossman School of Medicine and the Center for Early Childhood Health and Development in New York City, and Kai with Hamer, who is with ParentCorps and the NYU Grossman School of Medicine in New York City. So I'm going to turn things over to our first speaker, Bukola and Khadija.
Very much for the opportunity to present. Khadija will share our screen. So today we'll be talking about Black youth mental health and COVID-19 pandemic. It's based on a research project that we recently completed on the mental health of Black youths post-COVID-19. And as was said, Bukola and Khadija is a youth that was engaged in this project. Next slide, please. So race-based data on the mental health of Black youth in Canada during or after COVID-19 pandemic is not readily available. The pandemic poses a double whammy for Black youth as they had increased risk for mental health problems even before the COVID-19 pandemic, and also had increased risk of contacting and dying from COVID-19. In the year 2020, Black population had the highest mortality rate in Canada. Our proposed work was to examine the mental health of Black youth after the COVID-19 pandemic, and also offer interventions to address mental health risk among this demographic. So the first phase of our project was to interview 48 Black youths on mental health in relation to COVID-19. In the second phase, we surveyed 933 Black youths between the age of 19 and 30 years of age. In the third phase, we analyzed our data using thematic analysis for qualitative and logistic regression for quantitative. And now we are in the process of knowledge mobilization. Next slide, please. So we used an intersectionality framework that acknowledges the different histories and impact of social, economic, and political marginalization experienced by African, Caribbean, and Black communities, interconnected vulnerabilities and experiences of oppression which impact Black youth, such as income and gender, are linked to mental health. It provides supportive spaces for critical reflection, youth empowerment, and meaningful community engagement, and it allows youth to comprehend forces that shape their lives and recognize the capacities for change. We presented opportunity for youth to articulate their experiences while simultaneously recognizing their strengths and capacity, including their resilience, as well as the oppressive structures that limit this. Next slide, please. So in terms of our recruitment, we used social media for our recruitment through social media, my social media channels, and also the youth. We had an advisory committee of between 10 and 15 youths, and we also had a set of youth research assistants, about 5 or 6 youth research assistants across Canada that supported our work. We also recruited targeted recruitment through community agencies across Canada. So the first stage, interview were conducted over Zoom. We used interview guide that I initially developed, and then it was revised by the Advisory Committee of Black Youths and research assistants, and participants were given honorarium upon completion of the interviews. In the survey stage, we surveyed around 933 youths, and we actually surveyed more youths than 933, but 933 was how much useful data that we had. Data was collected online using RedCap and Black youth participated in the survey from across Canada. We sort of used a form of stratified sampling to ensure representation across different provinces of Canada based on the demographic distribution of Black people across Canada. And participants received a gift card in lieu of their time.
So in terms of the phase 1 participant demographics, of the 48 participants that we recruited, the mean age was 22 years old. And there was an even distribution between the male and female participants. So now, as we can see on the left-hand side, a brief description of our sample size. So most participants were educated with a university degree. A majority of our participants identified as Christian, and there was a wide range of reported household incomes. Now, to the right of the screen, we can see a distribution map of the participants' country of birth. And of note, 45% of our participants were born in Canada. And then finally, a majority of the Canadian provinces were represented amongst our sample size. So now the topic of reflexivity and how it was incorporated into our research. So reflexivity is the practice of evaluating one's own feelings, identity, and motives, and how they can influence what one does and thinks in a situation. So all of the research assistants did practice reflexivity during the interview process, and especially afterwards. And this was to really help to reduce bias, set aside any assumptions that we were coming in with, and to really connect more with the participants that we were interviewing. And the purpose of being reflexive in our research was to understand our social location. So what this means is, what is our age, race, gender, and actual geographic location and ability in relation to who we are interviewing? And how might it affect the research process? So how did we practice reflexivity? All the research assistants completed a one-page memo, basically including how they felt, any recurring themes or words that they noticed, and how they related to the participants, or any other insights that could be valuable. So for phase 1, we have highlighted several key themes and quotes that we've noticed. So our first major theme is mental health, and particularly relating to the lack of awareness of culturally safe mental health care, the culture of sports, and this notion of resiliency. So our interview data did indicate that most of the Black youth we interviewed were not aware of culturally competent mental health resources that were available to them. And this was in part due to insufficient promotion, which ultimately was a really big barrier to accessing these services. And notably, a few of the participants that were aware of the available resources said that these services were lacking in culturally competent and safe care. And now participants also commented about the importance of community, especially through extracurricular activities, such as sports. And because of the COVID-19 pandemic and its subsequent enforcements, such as lockdown, a lot of the youth that we interviewed weren't able to participate or complete their sports. So it really impacted their mental well-being. And then finally, this notion of resiliency. Many of our participants did comment how they accommodated to the changes of the pandemic and, quote, creating a response to it. And this really highlighted the high degree of resiliency that the Black youth that we interviewed were able to develop. Now, our second major theme was anti-Black racism, particularly relating to high stress levels and fear, anger, and emotional fatigue from the lack of long-term solutions, and this notion of multiple pandemics. So a lot of our participants did report struggling emotionally and psychologically with both the pandemic and the Black Lives Matter movement. They reported experiencing greater stress and anxiety levels. Many of our participants did share that it was difficult to balance those limitations imposed from the COVID-19 pandemic and their fear of attracting attention from the police or other individuals. This increased sense of stress and difficulty coping simultaneously with both the COVID-19 pandemic and the Black Lives Matter movement caused a sense of anger and emotional fatigue amongst a lot of our participants. A lot of the individuals felt that Black communities were experiencing a sense of exhaustion and fatigue, particularly with bearing this burden of having to respond to the notion of anti-Black racism and the experiences they had to deal with. And then our final theme was stress, as it relates to academic stress and financial stress. So as you previously saw, a majority of the Black youth that we interviewed were involved in educational pursuits. And the pandemic really caused a sense of increased stress and pressures amongst the Black youth. Participants described that this novel introduction of a new online platform, coupled with the lack of interaction with their peers at school, but also their communities, led to an overwhelming feeling of stress. Participants also suggested that this high level of stress was brought on by a lot of the delays that COVID-19 caused, for example, applying to post-secondary programs. And then finally, a lot of the participants voiced concerns about their stress in trying to navigate the difficult environment of employment, especially with a lot of the precautions that were previously mentioned. And this resulted in their inability to meet the basic needs that most of us have here today of shelter and food. Now, Dr. Salami will present phase 2 of our findings.
Thank you very much, Khadija, for presenting phase 1. So phase 2 was a survey of around 933 youths. And we had a diverse range of youths, diverse gender, age of youths involved. Notably, one limitation of our study is that we had a lower representation of youths that were out of school and out of work. So we had a bit of higher concentration of youths that were either in university or completed university. And one of the reasons for that is the research assistants and advisory committee members. Most of them were university students. And when you ask people to recruit, they tend to recruit people that have quite similar background as them. Next slide, please. So in terms of depression, we found that Black youths who had been treated unfairly, who felt that they've been discriminated against, were more likely to experience depression based on the rating scale that we used. And also in terms of resilience, we found that Black youths who were working part-time, those that had physical health conditions, and also those that had mental health challenges were more likely to, we are less likely to rate, had a poorer rating on resilience scales that we used. Next slide, please. So the limitations of our study is that 58% of our participants have completed a university degree or were in progress. 22% were completing or had completed a postgraduate degree. So we had an underrepresentation of youths that were not in employment or education. And that's why recruitment strategies, gaps in youth experiences and sectionalities persisted. So our study population also had a bit of, we had some non-binary transgender youths in our study, but it wasn't a significant, it was very, very minor sample. So our plans, we've submitted 4 papers for publication, and we're still in the process of writing about 3 more papers and translating our work to policy. And that is, implications. So implications for our study includes the need to address racism experienced by Black youths. So oftentimes when people think about the pandemic, they think about one pandemic. For our youths, the particularities of Black Lives Matter movement and anti-Black racism means by many of our youths, we're experiencing 2 pandemics at the same time. Increased access to sports for Black youths, as many Black youths said, sport is their main outlet to address some of the issues that they face in the society. And when the pandemic happened and sports outlets were shut down, that had a significant impact on our Black youths. Increase the diversity of the mental health workforce, advertise and share information on mental health in locations frequently accessed by the youths. So youths often said that mental health resources were often not easily accessible in locations where they tend to access. Implement initiatives to improve the economic outcomes of Black communities. And what we found in this study and in previous study is that income is probably one of the strongest determinants of mental health. And anti-Blackerism contributes to income inequality and also contributes to poor mental health outcomes. Thank you so much. That's about it. I'll pass it on.
Great, thank you. If I could pass the mic now to Laurie and Kai.
Hello, I'm Laurie Brotman, and my colleague Kayema Hamer and I are honored to participate in this webinar and to share about our work with Black families and other families of color with young children in the US. As a white researcher and scholar working with communities of color to advance health equity, my intention in this talk is to elevate the voices of Black scholars, community members, educators, and families. I would like to start by highlighting two key reports by Black scholars on the impact of the pandemic on Black children and families in the US. Both reports make the compelling case that the COVID-19 pandemic amplified inequities. Prior to the pandemic, Black parents were more likely to live in poverty, be unemployed and underemployed, have low income and wealth, be killed by police, and imprisoned in their lifetime. The pandemic exposed the historical and contemporary inequities that Black families experience every day and throughout their lives. The pandemic, coupled with racism, resulted in the lives of Black families and children changing for the worse, likely increasing disparities in health and well-being. In 2019, our racially diverse team at the Center for Early Childhood Health and Development launched a longitudinal study of families of pre-K students. We were about halfway through the first phase of telephone interviews with families before the pandemic hit in New York City. Consistent with our previous work, mothers reported high rates of mental health problems in themselves and their children. And predictably, based on structural racism, Black mothers experience the greatest mental health burden. In New York City, the initial epicenter of the pandemic in the US, schools were abruptly closed on March 16th, 2020. Because we were conducting telephone interviews for this study, we were able to complete assessments with the rest of the study families in the weeks after school closures. Through this natural experiment design, we were able to estimate the causal impact of COVID-19 related school closures on parent and child mental health. In this paper published in 2022, we found that school closures led to significantly higher rates of maternal depression and anxiety. This quasi-experimental findings were important, but not very surprising, since school closures disrupted nearly every aspect of daily life for families of pre-K students. To more deeply understand the experiences of families during the pandemic, we added a series of questions to our ongoing longitudinal study. Notably, nearly half of these families had an essential worker in the household. At 3 additional time points, from the summer after pre-K through the summer after kindergarten, we asked about 200 parents, how much has the pandemic changed your life? Here we're showing responses for the study sample overall in blue, and for the subset of Black families in red. In each area shown here, in family income, food access, and parenting stress, substantial portions of families of color with low incomes continue to be moderately or severely impacted by the pandemic 18 months after school closures. And in all cases, we see the familiar pattern of Black families carrying the greatest burden. In this case, 80% of Black families shared that they had to cut back on spending to be able to meet basic needs, or they were unable to meet basic needs and pay bills. And 40% of Black families reported that they were moderately or severely impacted with regards to food access and parenting stress in the summer after their children completed kindergarten. In the summer of 2020, just as we were hearing these stories from hundreds of low-income families of color, about the many challenges of parenting young children during the COVID pandemic. The NIH released a funding opportunity announcement for studies of community interventions to address the consequences of the COVID-19 pandemic. NIH was interested in existing multi-level interventions as well as new interventions. Our center is home to ParentCorps, a multi-level intervention to promote population health and health equity. We proposed a study that was ultimately funded by NICHD to see if ParentCorps could prevent the worsening of health and education disparities in communities hardest hit by COVID-19. This study includes a racially diverse team of investigators, the Community Advisory Board, and applies mixed methods, including a randomized controlled trial and focus groups with families in racial and language affinity. We call this study Community, Building Our Future Together. And now I'm going to turn it over to my colleague, Kayema Hamer, who's going to describe ParentCorps.
Hello, my name is Kayema Hamer, and I'm the director of ParentCorps. I come to this work as a Black woman, a mother, and a former public school leader working in a historically disinvested neighborhood in the Bronx, New York City, where I live as well. ParentCorps is a family-centered, school-based preventive intervention with potential to promote population health and advance health equity. It may also mitigate some of the impacts of the COVID-19 pandemic on children of color living in historically disinvested neighborhoods. Despite the promise of early childhood education, children are still not being set up to succeed in K through 12. Steep education inequities persist for huge numbers of children of color due to poverty and structural racism. This is in part because pre-K programs are not fully set up to build the homeschool connection and emotionally responsive environments that are key to transformative impact in early education. Educators often report these areas as key challenges and need more support to provide a high-quality, family-centered pre-K experience. ParentCorps' model includes 3 evidence-based components: professional development, designed to support pre-K educators to forge strong, culturally responsive relationships with families and promote children's social-emotional well-being; a parenting program designed to support families to promote children's early learning and development. Parents connect, share their experiences, and explore evidence-based parenting practices they may choose to incorporate at home. And then Friend School for the pre-K classroom, designed to support children based on the wealth of evidence that social-emotional learning is foundational for healthy development. Children learn to communicate their thoughts and feelings, develop a positive sense of self, and have fun. Our essential elements are what you see in the twinkles above the circles. This is our unique implementation approach and what we consider the secret sauce behind ParentCorps. They include building authentic relationships, examining race and racism, honoring culture, sharing the science of early childhood development, and practicing self-reflection. Through this model, we aim to support all the adults in children's lives and support strong family-school connections. And here we show our theory of action. On the left, the 3 components of our model, powered by our essential elements, work to support family-school connection and emotionally responsive home and classroom environments. These, in turn, support child social-emotional well-being and executive function, key building blocks for lifelong health and well-being. We have rigorously evaluated ParentCorps' full model in randomized controlled trials, including 1,200 majority Black children in historically disinvested neighborhoods. These trials show that ParentCorps has impact on pre-K teachers, parents, and children. I'll start with the adults. With ParentCorps, teachers demonstrated more responsive teacher-student interactions, considered an essential aspect of quality in pre-K classrooms. And parents showed greater involvement in children's learning, considered a critical building block for children's health and development. Most powerfully, ParentCorps has meaningful, sustained impacts on children's academic achievement, mental health, and physical health. This includes a 24% lower risk of reading below grade level in kindergarten and 50% fewer mental health problems through second grade. ParentCorps is one of very few early childhood programs with proven impact on mental health and education outcomes. This holistic impact is what makes our evidence truly unique and lays the foundation for children to thrive in K through 12 and beyond. A little bit about what educators are saying about ParentCorps professional development. 96% of teachers reported professional development strengthened their practice to support children's social emotional learning and engage effectively with families from different backgrounds. And 90% of school leaders reported that our professional development strengthened their ability to build positive relationships with families and their teaching teams. And I just want to take a moment to share the voices of parents who participated in our ParentCorps parenting program. I'll read the quote in blue in the center. The sessions did not only help me as a parent, but as an individual, which in turn helped my parenting. The safe space, support, and sense of community helped me to do the necessary introspection, offloading, and learning. It was an amazing program, which I wish was longer. Back to you, Laurie.
Thank you, Kai. I'm now going to share some additional context for our community study. In 2014, New York City launched Pre-K for All to provide universal access to high-quality pre-K for all 4-year-olds. In 2015, the mayor launched Thrive New York City, a population-level initiative to advance mental health citywide with a strong emphasis on prevention. Based on ParentCorps' evidence to improve mental health and education outcomes, the Department of Education awarded a contract to our center to implement ParentCorps at scale, focusing on pre-K programs in high-poverty schools and early childhood centers. We then developed a research practice partnership with the Department of Education, ParentCorps practitioners, and researchers to implement and evaluate ParentCorps at scale. We designed a series of implementation effectiveness trials, including one that is the basis for our community study. This study of ParentCorps effectiveness in district schools randomizes 80 high-poverty schools with pre-K programs to 3 conditions: ParentCorps with the 3 components that Kai described, standard professional development from the Department of Education to support high-quality pre-K, and for the first time, we had the opportunity to test the impact of ParentCorps professional development on its own. So we developed a new theory of action for professional development alone. We hypothesized that professional development, where educators are supported to build authentic relationships with families, examine race and racism, honor culture, and practice self-reflection, as well as learning evidence-based strategies, would lead to stronger family-school connections and more responsive pre-K classrooms, ultimately improving mental health, well-being, and school success for all children. We now have strong evidence from this trial that relative to standard professional development, ParentCorps professional development for principals and pre-K teachers leads to significantly stronger family-school connections. Over 4 years, based on questionnaires from thousands of families of color, we find that parents in schools where educators participated in ParentCorps professional development were significantly more likely to trust teachers and principals and to perceive the school community as inclusive. To our knowledge, this is the first demonstration of professional development that centers families and social emotional development with the potential to advance equity system-wide. Across multiple studies, we now have compelling evidence that ParentCorps implemented at scale leads to stronger family-school connections and better mental health and educational outcomes for Black children and other children of color. Of course, all of this happened before the COVID pandemic. In our community study, we have the opportunity to answer these important questions. Is there an enduring impact of professional development for educators on family-school connections as experienced by parents of pre-K students during and after the pandemic? Do children who were in pre-K programs with ParentCorps prior to and during the pandemic have better mental health and education outcomes in post-pandemic years? Does neighborhood context matter? And really importantly, beyond ParentCorps, what else do families of color need to thrive? We would like to end with some important lessons learned from doing this work. When working with Black families, it is critical to center Black voices in all phases and aspects of our work. When working with schools and other public systems, we now understand that systems change is necessary and it's possible. And at all levels, trust and strong relationships are essential. So we must ask ourselves, how can we, as researchers, educators, practitioners, systems leaders, and policymakers, work toward being trustworthy? What actions do we need to take to be worthy of trust from families of color and marginalized communities to promote health equity and to ensure that all children thrive? Thank you.
Thank you all for these excellent presentations that are truly inspirational. And you're building on the theme we heard from our earlier panel with our Indigenous communities, our Native American communities, the importance of building trust and hearing what our needs are of our communities when we're engaging with them and empowering them to develop new skills. So this is truly inspirational, and this is not easy work. And it's really impressive how much work you were able to do during the COVID pandemic and with all the challenges and obstacles coming your way. So thank you for all your efforts and all your achievements in that regard. One of the questions that we've actually had quite a bit during the COVID pandemic was the difficulty of recruitment. And yes, trust and building relationships is an important part of that. But what would you say to our fellow researchers out there that are still having problems with recruitment with underserved communities? If you were to start somewhere or give them advice on what's an important first step, what would you suggest? And I'd open it up to all of you, just to pick maybe the one thing that really stands out from your work in your communities. Thank you.
I'll start. So in terms of recruitment, the way that we were able to recruit participants was through our advisory committee. So we started by having an advisory committee of about 10 to 15 youths. And we also recruited research assistants about Black, and Khadija was one of those Black youth research assistants across Canada. And then they were able to help us in terms of recruiting from their network. And from there, we actually, our initial sample size, when we calculated the sample size we needed, it was 800 and I think around 850. We ended up actually getting way more than we needed. But one thing to be careful of when you use that as a recruitment strategy is the diversity of the initial set of people that support you in recruitment, because your final sample will, to some extent, mirror that diversity. So because we had diverse, we tried to have diverse gender, we tried to have diverse age, that also contributed. But because, for example, we have limited transgender, we had limited out of school, out of work, that also reflected in terms of our sample. There are other ways in the past we have been able to recruit, not in the context of COVID-19, but in the context of other studies I've conducted with youth, such as, for example, going to a basketball match, a football match, to be able to recruit African soccer tournament, to be able to recruit African men. I'm going to a grocery store to be able to recruit African parents on a study on parenting practices. So those are just some of the ways that we've been able to recruit in the past. But honestly, my past research with Black communities, probably it may be affected by my background as a Black person, but it's been very, very easy for me to be able to recruit. But I think that is because of my engagement in the community.
Excellent, thank you. Who else would like to share thoughts?
I'll just, I'm going to echo a lot of what Bukola said and share that for us, most of our work is happening in school communities. So we spend a lot of time and energy in partnership with schools and with early childhood centers. I will second the importance of, for us, racial affinity match in our team, from all the way up from the investigators to the people that are working in the field, talking to teachers, talking to families. And just give a little, I know you didn't ask for this, but I'll give a little request to the funding agencies in that this kind of work that is really community engaged and sometimes community driven takes deep relationship building, as we talked about, and trust, and that takes time and money. And I think it's one thing that we have to recognize is that we need support to build those relationships with families and with systems.
I think that that's right along the lines of what I was asking about. So thank you for sharing that openly. I appreciate that. Kai and Khadija, did you have anything to add about recruitment and your experiences in that regard?
I'll just piggyback on what Bukola said. When people feel that you care, that you're not just being extractive, going into the community to take information without relationship, without care, frankly, without love, people feel it a mile away, and it's harder to engage. If you found it easy, Bukola, because people can see your heart in what you're sharing and in what you're asking, and that's real.
I absolutely agree. I think being on the youth side of things as a research assistant, it was quite easy to relate to the participants on that level, and having the participatory research action approach, having folks who look like you and are in the same age range, it's easy to get that recruitment and that connection. So I think that would be a really good line of action for recruitment.
Excellent, thank you. Yes, we're reminding our audience the Q&A box is available. So we're keeping our eye on that. We have some additional questions from our planning team that we discussed when we were looking at your presentations, and we were impressed that Kai began as a parent in the project, and now she's a leader in the project. And so first of all, congratulations on your new position. But we're wondering what inspired you to become a leader in ParentCorps and to share your vision and your next steps with the community.
When I came to ParentCorps, when I encountered ParentCorps, I was a tired, burnt out teacher in the Bronx, New York, and I was asked by my principal to attend the professional development. And it is not hyperbole to say that it changed me. I resonated so much. They saw me, they believed me, they affirmed me, and I wanted to hear about how I could be a better educator. And because of that experience, I wanted to repeat that for others. I wanted teachers to feel cared for, heard, and valued enough to be able to share the evidence-based strategies that ParentCorps had to offer. It was real, and so I wanted to join up. After 11 years with the DOE in New York City, I came to join ParentCorps and had an upward trajectory, but that is because of what I felt and then what I wanted to replicate and the impact I felt like I could have as an educator. And as a result of that, the main part of my job now, which is the answer to the second part of your question, is that ParentCorps is growing nationally. We have a strategic growth plan, and we want to bring ParentCorps to every community that wants it. And just to say, I can share our website so that people can connect if they're really interested to learn more about ParentCorps.
Excellent. I love your enthusiasm. It comes really through in your voice and your attitude. So that's wonderful. I also wanted to ask Bukola and Khadija about this reflectivity approach, which was so interesting that all the researchers self-reflected to that degree and were so sensitive to influence on the people that they were interviewing. What were some of the insights from that process that you saw across your researchers? What did they realize when they put the spotlight on them after spending so much time interviewing others?
If Khadija, do you want to go first?
No, absolutely. Yeah, at first it was quite interesting. So it was a group of 6 of us. We were around all the same age, and as Dr. Salami mentioned, a good reflection of our population. But we found that a lot of the experiences that the youth were discussing, we've experienced ourselves in our everyday lives. So it was almost an awakening and awareness of, okay, I'm not experiencing this alone. Like other people across Canada, I'm in Montreal right now, but we had folks in BC and Nunavut. They're experiencing very similar things, to a degree different in their own region. It's particular, but I found that having a chance to write those memos, and we would also have an opportunity to go through them with the other research assistants and a postdoc fellow. So that was a really unique takeaway, I would say, from the reflexivity process.
And just to extend in the process of reflexivity to also the process of youth engagement, I think was very pivotal to some of the work that we do, because I think oftentimes when people collect, as Kai said, people tend to go to communities, extract and get out without really that reciprocal relationship of giving back. So one of the things that we've tried as much as possible to do in many of our work is to see in what ways youths may be able to benefit and youths may be able to grow. So Khadija, for example, now I think is the president or lead of Black Medical Students Association in Canada. We've had a dentist go through our program. We've had someone after our program, the head of policy for the mayor's office. I'm not the head of policy. One of the policy people at the mayor's office in the city of Edmonton was part of our a previous project we completed with youth, and we've had so much more that is happening with many of the youths that have engaged in our process. So I think as researchers think about collecting data from communities, they should also think about in what ways can you build the capacity of youths and the capacity of communities during that data collection process, so that then it's also a way to leverage the needs of the community.
Excellent. I would also like to put forward, since ITSE and NICHD are focused on research, what is the next research question that your activities to this point has become more evident to you as being the next priority? I know there are probably many, but if you were to pick one with limited time, what really stands out, particularly since we've been through this COVID pandemic period and now we're in the fall and we're seeing, some more cases, but what stands out to you in the research perspective?
The next thing that we are doing, we're just actually in the early process, is developing a guidance document on how to address the mental health of Black youths in Canada. So we are reviewing all the literature available, and we are also going to be doing some focus groups and interviews with diverse stakeholders to try and develop some. We actually realized that there's no guidance document that we know or guideline that we know that is focused on Black youths and mental health or across the world that we know. And that is our next step, to see how can we integrate, for example, experiences related to anti-Black racism into mental health standards and practices.
Terrific, thank you.
I'll share that, of course, we have a couple more years left on our NICHD study. And so we'll be doing that work. And we're also, now we have an intervention that has pretty powerful impact on families and children of color. And as Kai shared, we have a national scale plan to bring this to communities all over the country. Maybe Canada is next. We have a lot of questions about how to implement at scale in other communities, in different communities with different needs and assets and strengths and challenges. And so unlike, I think there's a history of developing interventions, showing that they work, and then letting go. And we know that they don't travel well. I think that's a big waste of money, and nobody's going to benefit from that. And especially families of color are not going to benefit from those investments. And so we are deeply committed to an anti-racist approach to understanding scale and continued impact.
Well, we're out of time. Thank you all so much for your insights and for sharing your inspirational work with us today. And we hope that you'll be able to continue your communication with each other. It seems like you have a lot of common goals and ideas there. So thank you all so much.